Assessment, the doctor's order. Next, the client level of consciousness and level of knowledge and understanding. Next, the availability and functionality of the needed materials. Next is the assess the mental status of the ability to participate in the procedure. We are moving for the planning. If possible, determine whenever the screening or complete neurologic examination is indicated. The impact of the preparation to the client, equipment, and time in preparing equipments. 1. The percussion hammer, wisdom, or cotton. Assess the light touch, sensation, sterile the safety pin for the tactile discrimination, sugar, salt, lemon juice, corn flavors, percussion, turning fork, tongue depressor, paper clip, pen light, clean gloves, and we're moving for the implementation. 1. Introduce yourself and verify the client's identity and explain what the client what you're going to do and why it's necessary and how the client to cooperate. Perform hand hygiene and observe for the other appropriate infection control procedures. Next is provide the client privacy. Inquire if the client has an history of the following: presence of pain in the head, back, or extremities, as well as onset and aggravating and evaluating factors, disorientation to the time, place, or person, speech disorder, and any history of loss or consciousness, fainting, convulsion, trauma, or tingling, or numbness, tremor, or tics, living paralysis, uncontrolled muscle movement, loss of memory, or mood swings, problems with smell, vision, taste, touch, or hearing. Cranial nerves, assess the cranial nerves, the olfactory, as the client to close their eyes and identify the different mild tremors such as coffee and vanilla. Next is the optic, ask the client to read the Snellen chart, check the field of vision by confrontation. Next is the CN3, perla, a pupil reaction. CN4, Torre assist 6, ocular movement, trigeminal wheel, the client looks upward, lightly touch the lateral sclera of the eye to visit the blink to test the light sensation, have the client close the eyes and wipe off the custom over the forehead and paranasal sinuses. The test to deep sensation, use alternating blunt and sharp ends of the safety pin over the same area. Next is the cranial nerve 7, facial. The facial, ask the client to smile with the eyebrow, front, puff up cheek, and close eyes tightly. Ask the client to identify the bar stays. Place the tip of the side and of the tongue, sugar, salt, and identify areas of tics. Cranial nerve 8, auditory, assess the client's ability to hear the spoken word and the abbreviation of the tuning fork. The cranial nerve 9, glossopharyngeal, apply the taste to the posterior tongue, identification, ask the client to move their tongue from side to side and upward and down. The 10, vagus, assess with CN, assess the client's speech or for hoarseness. For the cranial nerve 11, ask the client to shrug his shoulder against resistance from your hands and turn head to sides against resistance from your head. Repeat for the other sides. Cranial nerve 12, the last one is hypoglossal. Ask the client to protrude the tongue at the midline, then move it side to side. For the evaluation, evaluate the patient's response to the procedure, document the procedure, and other important data on the client's chart. And that's all, and thank you.